It has been 10 minutes, and so she was laying on the foam for a total of 10 minutes, after which I placed this on her sacrum at levels S1, S2, and S3, and I leaned into the table. The table took up my weight, and that way I didn't tire of this posture, and I just leaned with my forearm into her sacrum with about 15 pounds of force, and just maintained that for 5 minutes. And it is that simple. Let's take this out. And so I'm going to do a superior spring test, and you'll notice that I can take up the slack very easily now. And I can thrust it, and you can see it spring and recoil. So the force transmits through that structure. The sacrum is now deep. I fall off. Instead of climbing onto the sacrum, there's now a sulcus there. The sacrotuberous ligament is here, and I can now indent that. That feels normative. And here's forward rotation. Inferior glide. PA spring on the sacrum, and I can see movement all the way down to her heels. Let's have you lie on your back, please. And now I can get some side glide through the pelvis. And when I do a posterior rotational spring test, there is movement. It's stiff, so you could have the pattern that we call bilateral anterior ilium. There could be a degree of that present. So there could be a little bit more work to do, but there is movement in this direction that we did not have before. So I think it's a good place to see how you feel. Let me change the camera angle, and let's just have you walk down the hallway and back. You aware of anything?
I mean, it feels... I still have some pain when I lean backwards.
Yes.
Into this area here.
Uh-huh.
Just gonna walk again. It's hard to say what I feel.
That's fine.
Yeah.
That's fine.
Yeah.
Very good. It may be that in time you may notice some difference.
Yeah.
But we have more work to do, so
Okay.
we'll keep going.
All right.
But the point of the film is that there was a restriction there.
Yep.
And you've had it for a couple of years.
Yep.
The injury was in 15?
The one where I really noticed the injury was, 14.
Yeah.
Yeah.
Very good. Alrighty, we'll continue.
Okay.
Thanks.